aiming to harmonize efforts and promote alignment among development partners and NGOs, supporting Ministries of Education to improve WASH in schools or WinS services. The network has been established in 2010 as an informal network and has expanded its number of member organizations until today. It is fostering a global community of practice on WinS to harmonize strategies of development partners and NGOs for supporting governments around the world to plan, finance, implement, and monitor integrated, inclusive, and sustainable WinS programs. In 2012, GISAT and UNICEF facilitated the very first WASH in Schools International Learning Exchange. The event is happening as an annual meeting that aims to facilitate exchange between country delegations to learn from each other, with the intention to showcase and further improve their respective national WinS programming. In 2014, the three-star approach was developed by WinS network partners UNICEF and GISAT to support countries in assessing their WinS status and be guided on setting priorities on reaching the national standard. The three-star approach provides a stepwise pathway for schools to gradually improve towards realizing national standards. A corresponding accreditation mechanism recognizes schools' progress using a star system. In 2015 and 2016, many partners of the WinS network supported the work of the WHO UNICEF Joint Monitoring Program in the development of indicators for three target areas of the WinS-related Sustainable Development Goals. As a result, the SDGs now mandate all countries to ensure that schools provide access to drinking water, basic sanitation services, and basic hygiene services for all children by 2030. This ambitious objective, along with the emergence of the COVID-19 pandemic, has created new momentum for WinS and has urged ministries of education around the world to act and accelerate progress towards reaching the SDGs for WASH in schools. The network partners concurred that these crises should not be wasted and should instead be used to integrate WASH more systematically into the core responsibilities of the education sector. Recognizing the increasing demand for technical expertise on WinS to support governments on their WinS implementation, the WinS network is offering a knowledge hub with a wide range of information such as global guidance documents or resources from trusted sources and publications in peer-reviewed journals, as well as information on upcoming and past events on WinS. The network has also organized a series of webinars which served as an avenue to share and learn best practices around intensifying WinS within the pandemic context. To this end, the WinS network will continue to provide a platform for exchange, collaboration, and alignment in support of ministries of education across the globe.
Great, thank you. And welcome everybody. COVID-19 put really front and center water, sanitation, and hygiene. We saw lots of country examples where momentum was created by Ministry of Education leading. They were leading with development partners, NGOs, private sectors. Things such as protocols, finances, teacher training, data were all very, very important elements to ensure that schools could safely reopen and also to ensure that kids were kept safe. And we see this really as a very important investment, a valuable investment moving forward. My name is Belinda Abraham, and I am with the WinS network. I'm supporting the Secretariat as well as with Viva Con Agua. And this afternoon's session, we'll look at, first we'll see some latest data from JMP on what is the situation and the status in schools. Then we'll get some really interesting country examples from the Philippines, Malawi, Kenya, on what they were actually doing. What have been some of the strides they have made? And then followed by that, we will, of course, open this for a session to discuss what more can be done to keep this momentum. How can we continue to ensure situations like equity, gender are still being addressed? So I look forward to a very engaging, interactive session. And I also invite you all to also reflect on the programs that you have and what experiences you have, so we can have a very nice and rich discussion moving forward. Good. So with that, just to set the agenda quickly, we will begin with an opening remarks by Dr. Tanya Fallback. She is with the BMZ, and she is the Deputy Director of General Global Health, Resilience, Equality of Opportunity at the German Federal Ministry of Economics, Cooperation and Development. And thank you, Dr. Tanya Fallback.
Yes, thank you so much. It's not only a difficult name, but also a difficult title. So good afternoon, but you managed excellent. Mrs. Grace Miller, Dr. Dolmarco, dear panelists, dear ladies and gentlemen. So it's my great pleasure to welcome you to this session, either in Stockholm or on site or remotely, to this very interesting WASH session in schools, linking education, health, and gender. It is an equally great pleasure to do so on behalf of the impressive group of co-conveners, the WASH in Schools network hosted by the GIZ, Program for Water, Sanitation and Hygiene of UNICEF and WHO, the Sustainable Sanitation Alliance and UNICEF. So, and I want to excuse myself that I have to move in the middle of the session to the next session, but I'm very aware of the WASH program and I'm very proud that we developed it so far. So what happened in 2015 with the Sustainable Development Goals? The world leaders have set the target of reaching universal access to water, sanitation and hygiene in schools for everyone and everywhere by 2030. So we know that this goal is ambitious, but we also know how essential it is. Access to WASH is part of the fundamental human rights. It is very closely linked to education, health, and gender equality, but also with the environment, good governance, sustainable financing, and many other areas that we all care for the development sector. So in that, water is the central resource of life. Comprehensive hygiene is crucial for reducing health risk. And as I'm also the director for global health and One Health in my ministry, I really want to see that it becomes more of the narrative of the prevention of global health, of this discussion, because I see that this is still very much separated. So water is the central resource of life. Comprehensive hygiene is crucial for reducing health risk, and menstrual hygiene is essential for the equal participation of women and girls. As BMZ, the Federal Ministry for Economic Cooperation and Development, on which behalf I'm talking here, we are therefore considering WASH as an important element of global health, and we are expanding our commitment in the area of WASH for health. So the past 2 years, or the past 2 years and a half of the COVID-19 pandemic have shown us again how fundamental WASH is, and it was really a call for WASH. This is what I would say. Everybody understood how important that is. So the pandemic also taught us 2 important lessons regarding WASH in schools. Firstly, more efforts need to be made to reach the WASH-related SDGs. And while progress has been achieved over the past years, access to WASH in schools is still not that given, and we need to accelerate progress to be made WASH in schools for all a reality. We will hear more in the global status of WASH in schools today from the expert of the Joint Monitoring Program, and I think this is really interesting. So second, access to basic WASH services in school is key for a safe and health promoting learning environment. And WASH in schools is essential for pandemic preparedness and response so that schools can remain open or can be opened again safely to ensure that students can benefit from education and other services provided by school. We all know the numbers, what is the lag in between what school kids missed, and most of you and I myself have kids in school. We see what happened within this 1.5 years. So Ministries of Education therefore play a crucial role in leading and coordinating WASH in schools. And we will learn from 2 country representations today on how their ministries have responded to the pandemic and how they are addressing challenges around WASH in schools. For me, as the Deputy Director General for Global Health, Resilience and Equality of Opportunities, it is particularly important that children and adolescents everywhere are attending schools and that offer a health-enhancing environment so that they can acquire healthy habits, benefit from good quality education, and enjoy a setting that provides equal opportunities. Allow me to highlight that WASH in schools is also an important measure to address gender equality. In this, it underlines our aim of a feminist development policy of my minister that realize equal social, political, and economic participation of all people, regardless of their gender, gender identity, or sexual orientation. In schools, this includes, but does not stop, with appropriate sanitation facilities for boys and girls and measures for menstrual health. Simple but essential measures have been proven effective to prevent premature dropout of girls and are facilitating equal opportunities of all. So it is great to see that the partnership between Asian Ministries of Education and German Development Cooperation in the region Fit for School program resulted in important improvement in WASH in schools in partner countries. Also, I am very pleased to see that knowledge and experience collected by the GIZ and its partners through Asia are utilized for other regions as well. The International Learning Exchange on WASH in Schools and the WASH in Schools Network are 2 great examples for platforms to disseminate these learnings, exchange and best practices. So I'm excited to see what we heard today about these experiences and models. And I'm really a fan of this WASH program. So on behalf of my ministry, I'm proud to say that we remain committed together with our partners to work on WASH in schools and to strengthen this intersectoral collaboration through our focus on WASH on health. I thank the organizers for hosting this exchange and for bringing these key stakeholders together. And it is great to see so many of the leading partners in this sector are joining forces to improve health, education, and gender equality through WASH in schools. So we would like to recognize and acknowledge the strong partnership with UNICEF and the contributes of private sector partners such as Unilever in this context. So BMZ is grateful for the trustful and impactful partnership. I'm looking forward to the discussion and the presentation of the projects. Thank you.
Thank you very, very much, Dr. Tanya Rodriguez-Bovec, for really laying the foundation for the session to come, tying very beautifully the importance of health, equality, gender to our forward agenda for education for children. So thank you very, very much. So with that, I would like to get into understanding our global status of Washington schools. Where are we? And we will have a specific kind of focus on pandemic preparedness and response and gender. And we're very, very pleased and honored that Tom Slaymaker will be doing the presentation. And he is a senior statistics and monitoring specialist with the WHO and UNICEF under the Joint Monitoring Program for Water Supply, Sanitation, and Hygiene. He has over 18 years experience working in the field of international development, engaged in public policy, advocacy, aid, and poverty reduction in Africa and Asia. So pleased to have you here with us and really looking forward to hearing from you.
Okay, thank you very much for that nice introduction, and also for the invitation to present to this group. As I think you know, this is a joint program between WHO and UNICEF. I manage the UNICEF side of the program. My colleague, Rick Johnston, who manages the WHO side, is also in the room. The JMP produces updates every 2 years. We released a data update, which is a slightly smaller update on Washington schools in June. And I'm just going to give you some of the highlights. I cannot possibly present everything that's in the report. I'll give you the highlights and some of the things for you to look out for when you read the report later on. So firstly, just to make sure everybody's on the same page, I'm sure many of you in the room will be very familiar with the indicators that we use for tracking progress at the global level. We have the SDG 4 target, which specifies access to basic drinking water, basic sanitation, and basic hand washing facilities in schools. It refers to the definitions produced by the WASH sector, which were developed by the Washington Schools Network and the JMP and many other stakeholders. And these are our service ladders. So I think you know that a basic drinking water service means water from an improved source, and water is available at the school at the time of the survey. A basic sanitation service is an improved sanitation facility at the school. It is single sex and usable. And when we say usable, we mean available, functional, and private at the time of the survey. And a basic hygiene service is a hand washing facility with water and soap available at the time of the survey. The limited rung on the ladder means that schools have some of the things, but not all of the things to meet the criteria for a basic service. And then we also have this rung, which is no service, which means they either use some sort of unimproved technology or there's no service at all. So these are the headlines, which, I have the wrong PowerPoint here. I've just realized. Do you mind if I switch it over? Yeah. Sorry. So these are the global headlines from the report. And here you can see we're tracking progress between 2015 and 2021. You can see progress on drinking water has been slower than it has on sanitation and hygiene. And you can see that if we continue the line at the current rate of progress between 2021 and 2030, that we're not going to meet the target of universal access to basic wash in schools. We would effectively need a 14-fold acceleration in current rates of progress for drinking water, a 3-fold acceleration for sanitation, and a 5-fold acceleration for basic hygiene services. And then if we look at the least developed countries and the fragile contexts, obviously the acceleration would need to be even greater. And effectively an over 100 times increase in the least developed countries for basic sanitation in schools. And at the bottom here, you can see progress towards ensuring that all schools have at least some kind of service. So eliminating no services. And again, at current rates of progress, we are on track to ensure that no schools have no sanitation service. But unless progress accelerates, we'll still have around 1 in 9 with no drinking water service and 1 in 7 with no hygiene service. So these are the sort of headlines in the report, and then I'm going to unpack them a little bit more for you so you can see what lies behind them. And we produce updated national, regional, and global estimates. You can see globally, we now estimate 7 out of 10 schools with a basic water service. And we have data, we have estimates for 7 out of the 8 SDG regions. But you can also see that coverage varies very widely. And in fact, we don't have sufficient data to make recent estimates for Latin America and the Caribbean. Unfortunately, we can't make estimates beyond the year 2015. But for all of the other SDG regions, we have reasonable confidence in the status and trends. And then if you look at the individual countries, which we're using in order to generate those regional and global estimates, you can see again, there's very wide range of service levels. There are about 61 countries there that have already achieved universal access, but a third of those are in Australia and New Zealand and in Europe and Northern America. And in all of the other regions, we have at least one country with less than 50% coverage. And in some countries, there are about 20 countries there where more than 1 in 3 schools have no service at all. We turn to sanitation. Similar proportion, 7 out of 10 schools worldwide with a basic sanitation service. And we have estimates for all of our 8 SDG regions. But there are even bigger variations here. And we also see that in some regions, there is apparently a negative trend. But I really want to draw your attention to fragile contexts and least developed countries where we still have less than 50% of schools with a basic sanitation service. And again, the national service levels are varying widely. The countries below 50% coverage tend to be more concentrated in sub-Saharan Africa, in Central and Southern Asia, and in East and Southeastern Asia. And there are a number of countries there where we have data on the proportion of schools that have no service, but we don't have sufficient data to be able to estimate limited or basic services. And those are shown in gray. So that's effectively insufficient data to make an estimate. And again, in 14 countries there, we've got more than 1 in 3 schools with no service at all in 2021. And last but not least, hygiene. 58% of schools now worldwide with a basic hygiene service. Most of the SDG regions with data, but very low coverage, much lower coverage in sub-Saharan Africa and Oceania. And I think more than half the countries which are still below 50% are concentrated in sub-Saharan Africa. If you zoom in the report and you look in detail here, we've got some countries like Ethiopia, Malawi, Sudan, where more than 3/4 still lacking a hygiene service in 2021. And in the report, we try to further disaggregate the national data. We try to look at rural schools and urban schools. We look at pre-primary, primary, and secondary, and we often see significant differences. In some countries, there's very little difference. But in some of these countries, there are quite big gaps in coverage between urban and rural and different school levels. And that's important when we think about where we need to concentrate our efforts. And we also increasingly try to estimate trends and rates of change. And these charts are showing you the existing coverage and the rate of change between 2015 and 2021. And by putting those 2 pieces of information on the same chart, we can plot whether or not countries are on track, if they continue with the current rate of change, to meet the target of universal access by 2030. So if you're in the blue triangle or the green triangle or the purple triangle, then you are on track. If you're in the yellow zone, you're making progress, but it's not enough to get you there by 2030. And if you're in the orange zone, actually coverage is decreasing. So on the water chart there, you can see Serbia is an example of a country that's made rapid progress over 5 percentage points a year, and is one of a couple of middle-income countries which is on track. In the sanitation chart in the middle, you can see Togo, an example of a country that's made really rapid progress, doubled coverage from around 36% to 79%, which means it's catching up with some of its middle and high-income neighbors. But there are many other countries which are still in the yellow zone, which means that they're not progressing fast enough. And there are also some in the orange zone. If you look at the sanitation chart in the middle, we have the example there of Burkina Faso. And in Burkina Faso, coverage has actually decreased by 3.6 percentage points per year between 2015 and 2021. And in the report, we try to show the absolute numbers of children affected by not having basic wash services in their schools. And we try to show where they are distributed across the different SDG regions. And you can see for water, for sanitation, and for hygiene, the total number of children, school-age children, without basic services at their school is coming down. And it's coming down in most of the SDG regions. But you can also see that they are increasingly concentrated in 3 regions, particularly sub-Saharan Africa, Central and Southern Asia, and in the case of sanitation, East and Southeast Asia. But while the total number is coming down in Central and Southern Asia, and in East and Southeast Asia, in sub-Saharan Africa, the total is going up. So what that means is that the rate of progress on wash in schools is not keeping up with population growth. And that's a very important thing to point out. So that's the basic services, but we don't just look at the basic services. We try to highlight other additional indicators which we think are relevant and important for monitoring wash in schools. Wherever we find them in the national data sets, we try to highlight them in the report. This most recent report had a pull-out on pandemic preparedness, and it had a pull-out on disability-inclusive wash in schools. And so I'll give you some brief highlights from both of those. The first is that we tried to analyze not only coverage against the individual indicators, so basic water, basic sanitation, and basic hygiene, but also the proportion of the schools which meet all 3 criteria together. So these are examples of countries where we have very detailed information, we have microdata right down to the school level, and it means we can analyze the proportion with basic water, proportion with basic sanitation, the proportion with basic hygiene, and the proportion with all 3. And in all of these countries, the proportions with all 3 are significantly lower than they are for the individual components. And I think this just illustrates that there are significant challenges. Some schools have challenges with drinking water, others have challenges with sanitation or with hygiene. It's not necessarily always the same schools in the same part of the country. We have some great examples of work that's been going on in response to COVID. This is an example from Ecuador, where there was a very rapid assessment of wash in schools at the beginning of the pandemic. And what they did was they were able to collect very detailed, disaggregated information on water, sanitation, and hygiene. And this chart is showing how the coverage of basic hygiene services varied across the country. So you can see there's very little difference between rural and urban in Ecuador, but there are huge differences between the different provinces, ranging from 70% down to 24%. And then they also looked at whether or not there were group hand washing facilities in place and individual hand washing facilities in place, and then the condition they were in. So whether they were in good condition, whether they're in good condition with water, in good condition with water and soap. So really detailed information that enabled them to identify where the problems were and to look at different school levels individually. And here you can see there are quite big differences between primary, pre-primary and secondary. But it's not always the same. So there are different patterns that we see for different indicators. But this is one of the few countries that has really detailed, disaggregated information that could then be used to assess what was required in order to make it safe to reopen schools in Ecuador. Another interesting example of a country that's made really rapid progress is Cambodia, where coverage of group hand washing has increased by around 20 percentage points between 2020 and 2021. That's an extraordinary jump. But you can see from the chart here that progress has been achieved at all school levels. So pre-primary, primary, and secondary, and also in all of the 25 provinces. So although they had quite different starting points, the coverage has dramatically increased over a very short period of time. And in some provinces, I think Priya, Sanuk there, you can see there's a 50% increase, percentage point increase in coverage of group hand washing in schools. So it shows that rapid progress is possible with enough focus and effort, it is achievable. There are some other interesting examples. Iran is a country where there is data on compliance. So whether or not children are washing their hands, always, sometimes, or never, before eating and after using the bathroom. And you can see they're much more likely to wash their hands after using the bathroom than before eating. These are equally important indicators as whether or not the hand washing facilities are actually available. And in the context of pandemic preparedness, there's been a much bigger focus on cleaning and also on waste management. These are just two charts from our report. The one on the left is showing you the cleanliness of toilets and also how frequently they are being cleaned. And so you can see the proportion of schools with any toilet, which is the triangle, and then the proportion of schools with a clean toilet, which is the diamond. And you can see there's often a very big difference. So again, it just draws attention to the challenge is getting beyond providing toilets in schools. It's ensuring that they're clean and ready to use, and they're going to be bringing the benefits to the children and to the teachers. And on waste management, what we found here is for the small number of countries where we do have data on how schools are handling solid waste, we can see that there are a range of different methods, but in many countries, the majority of schools are simply burning waste on site. There is no solid waste collection and safe disposal. And really, burning of solid waste on site is not a safe method of disposing of solid waste, and is potentially presenting a fairly serious health risk. Moving on to disability inclusive wash services. This is a very challenging area for us to look at because there is not currently a standardized set of definitions for disability inclusive wash services. In the report, you'll see this table, which is showing the different indicator definitions that are currently being used. Some of them are focusing on adaptation for limited mobility. Others are focusing on students with limited vision or small children. Some of them specify the type of adaptation that you're expecting to see, whether there are rails or there are ramps. Others don't. They just have this category of disability inclusive services. So this just makes it very hard to compare across countries. And I think we need to do a lot of work to develop some standard indicators so that we're able to do that in future. But we can do within country comparisons. So we can look at the availability of disability accessible drinking water, sanitation, and hygiene, for example. These are some countries where it's possible to do that. And in almost all those countries, schools were more likely to have disability accessible drinking water than disability accessible sanitation and hygiene. And in some countries, coverage of disability accessible drinking water was far, far higher. So I think Tanzania there, you can see nearly 5 times higher than disability accessible sanitation. But coverage also varies across the different school levels. There's no obvious patterns, but in some cases, secondary schools were more likely to have disability accessible facilities. In other cases, it was primary schools or pre-primary schools. But this is important information to have in order to be able to address the problem. And these charts are showing the difference between having any water source or any toilet and having a disability accessible water source or a disability accessible toilet. So in the countries where we have this type of data available, you can see the drop between coverage of any water source and coverage of a disability accessible water source. And in many cases, it's a very large drop. And for sanitation, even bigger. So in over half of those countries where we had data on the gap for sanitation facilities, that gap exceeds 50 percentage points. So it's a massive difference. And I think it just illustrates the scale of the challenge with increasing access to disability inclusive wash services in future. This is an interesting example from Tajikistan, and just the reason for putting this up is it's a slightly different type of indicator. It's not just assessing whether or not there are disability accessible facilities, it's asking whether students have difficulties in accessing them. So here you can see that many of the facilities can be accessed without any difficulty, some of them with some difficulty and some with a lot of difficulty. And then they've zoomed in on those where they found at least some difficulty, and they've made some observations about the types of facilities that are available. And you can see the proportion where, you know, there is a clear path with no obstruction, steps or stairs, for example, or where there's a tap and soap are reachable from a seated position. And you can see that it's relatively small number of schools which are meeting those national standards for accessibility. So we need both types of information. Are facilities available, but also can the students actually use them? So I just wanted to highlight, there's been continued growth of the global database on Washington schools. The baseline report we put out in 2018, the update in 2020, and our most recent update in 2022. You can see the total number of national data sets that have been used has continued to grow. This is really a testament to the work of the Washington Schools Network and all of the different stakeholders who've been progressively integrating these new indicators into national monitoring systems. And it means that we're able to produce estimates for more countries, and we're also able to get a much better understanding of trends and rates of change. Most of these data are still coming from education management information systems and also from school surveys. All of the national data that the JMP uses to produce estimates are listed in the country files. And we send these out for a period of consultation with national stakeholders before we publish the estimates. So you can pick the country you're interested in, and you can go in and you can look at the actual underlying data that we've used to produce these estimates. And for the first time this year, the JMP country files are actually available in multiple different languages. So when you open the file, you can choose which language, which UN language you would like to view it in. And that will hopefully improve the process of country consultation and the understanding of national stakeholders about how these estimates are being produced. But I just want to leave you with this. So this is showing the current status, the global availability of data on basic wash in schools in 2021. And you don't need to understand the detail of this, but the dark blue and green and purple means that we have coverage for at least 50% of the population. The lighter shades mean we have data for between 30 and 50% of the population. And the yellow means that we currently only have data for less than 30% of the school-age population. So it's the yellows that we really need to focus on. And you can see if we have data for less than 30% of the school-age population, we will not make an estimate. It's not sufficient to make an estimate. And you can see that there's more yellow for hygiene and for sanitation than there is for drinking water. There's more yellow for pre-primary, and there's more yellow for urban and rural. So this is really where we need to focus our efforts, our continued efforts to strengthen national monitoring systems. We have our core questions, which many of you have already been using and integrating into national monitoring systems. And this year, we've also published a much more detailed explanation of the JMP methodology. So that is also available if you would like to understand in more detail exactly how the estimates are being produced. But I'm going to leave it there. Thank you very much.
Wow, thank you very much. Very enlightening. I think actually something that stuck with me actually in one of your earlier slides with all the gray lines and basically showing the data that isn't actually there. So what is not even being measured is not even mattering. And this is a big concern, but thank you very, very much. I'm going to open the floor up for maybe a few questions. I see some hands already, so I need to give you a microphone. And so I will take, maybe we can take, and John, sorry, Rick, you are, Rick Johnson, you are also on the hot seat. So let's start. Yeah, we can.
Hello, everyone. My name is Lisa, and I manufacture household water filters, which we distribute to schools, primarily in Indonesia, but we're also planning to scale into Kenya and Ethiopia. Thank you so much for sharing this data. It's really fascinating. And I'm really happy that those data are being collected. Although I'm a little bit shocked because we moved from the MDGs to the SDGs. And what made me so happy that in the SDGs, we had safely managed drinking water. That's really the darkest blue thing on the SDG 6.1 ladder. If I look here at the scheme, it says drinking water from an improved source. Ladies and gentlemen, if you would be visiting one of these schools with an improved source, would you drink that water? Well, that's my question. We are here to help you. We provide WHO certified water filters, which we have distributed to over 200 schools in Indonesia. We really want to expand this, and we can do this together to ensure that those schools also have safely managed drinking water in the schools and that the children don't get ill when they are at school. Thank you very much.
So we can take maybe a reflection of that, but then we'll just take one question because I understand online we have Malawi, Kenya waiting for us. So I'm a little bit pushed. So yeah.
Very impressive presentation, quite usual of you. I have just one question. Why did you choose to, for the purpose of waste management in the school, the burning question, whether the waste is being burnt and not anything else? Did you explore any other indicator? Because burning means that there is some effort going on. Or somebody's attending to the waste. The much worse situation is when waste is all over the campus. So I was just curious to know, why did you choose that?
You want to attempt it?
Want to take safety management?
Sure. Well, thanks for the point about drinking water quality in schools. We are very concerned about higher levels of service, and in the report, we, sorry, not in this report, in the previous report, we drew on additional indicators about drinking water quality in schools, but it's just not as widely available. So the data, yes. Yeah, but in terms of interventions to improve drinking water quality, I think there is a lot that is being done and can be done in schools. So happy to hear about your filter program. For waste management, this is it's a bit of an overlap area because we have a lot of information about waste management in healthcare facilities, but we tried to apply some of that to schools. Tom, you go ahead and you take it.
Yeah, so this is something where we have very few countries that are collecting data on solid waste management in schools. So we tried to identify a small number of countries that had some good data, and the categories were collected by a waste disposal system, buried on premises, burned on premises, openly dumped on premises, or no management at all. So all of those were in the chart. But what I was highlighting was that the majority of them seem to be burning on premises. So that's a risk, but it's also an encouragement to collect this type of data more systematically, because I agree with you. Some kind of management is better than no management at all.
Thank you. And I see there was a lot of interest so that you can use the Pathable chat, put your questions there. We'll try to also do it the new digital way. So thank you very much. And I think with that, we move forward. We have online with us two speakers who will be giving, we've got sort of a global status example. Now we're going to get a little bit of what actually countries are doing, what governments are doing. And we have, fortunately, two speakers. We have Mrs. Grace Milner, who is the Director of Basic Education in the Ministry of Education in Malawi. She has worked for more than 25 years with the Ministry of Education Planning Directorate in various senior positions. She has a master's degree in education as well as a bachelor's degree in education from the University of Malawi. So she will be joining us, as well as, and maybe I'll just do the intro as well, for Maurice Mando, who is a public health professional with over 6 years experience in expertise in policy development, implementation, project designing, coordination, partnership building within the sector. He's worked with the Ministry of Health, the School Health Department within the Ministry of Health, and is now with AMRAT. So with that, we're going to have two of them to give a country level context. So you can help us get there. You're here, so keep the conversation going.
Hi.
The technology.
Hi, this is kind of in a similar vein to the previous discussions, but SDG 6, the indicators are all about safely managed water services and safely managed sanitation. So why then is JMP only measuring basic? Yeah.
Okay. Take somebody, yeah. Take a couple of.
I'll share two quick questions and you can answer what you want. My name's Erin. I'm from Drink Local, Drink Tap Uganda. We implement rural wash projects. So we use M-Water as our app for monitoring. We monitor projects long-term. There's no cutoff date. Are you using data from apps like this to enter into these types of reports? And my second comment is, the title of this session has gender included in it, but we haven't talked about menstrual hygiene management as part of hygiene and options for that. And in Uganda specifically, we lack clarity around what is safe in this space. There are little to no standards, and the only standards we've been given is to burn menstrual products. So I'd love to hear more about that.
Maybe we can take them and then we will. Yeah, thank you so much.
Yeah, thank you for the questions. And I think some of these questions are about monitoring, and some of them are getting on to, normative standards and approaches. So other people in the room may be better placed to answer those. But why is there no sort of safely managed equivalent for schools? This is primarily because we've only been monitoring wash in schools since 2015. We've been monitoring wash in households for many, many years. And so the data which are available at the country level are much richer. And so we're able to have additional rungs on the ladder, and we're able to report on those at the global level. We have a handful of countries that we're aware of which have data on these advanced indicators like drinking water quality, like safe management of sludge from septic tanks and from pit latrines. And so those things are highlighted in our report to give encouragement to other countries to start to collect them in future, but we simply don't have enough data at the moment to be able to monitor those things at the global level. So we'll continue thinking about an additional rung above and beyond basic. But as you can see, many countries are still struggling to meet the basic service level. So we also have to keep that in mind. We are using data that's coming through M-Water and other apps. I think that's fantastic. The only consideration for us is that the data should be nationally representative. They should be representative of the entire rural or urban population. They should be representative of different school levels. And of course, they need to be approved by the national government so that we can use them for official estimates. I don't have an answer to your question. What constitutes safe MHH? I think that's a live discussion. There are many different components to it, so I don't think we should try and answer it now.
But we might have some reflections if we get connected from the country level examples, because I think there is varying policies and procedures being put in, some more advanced than others. And I do think these are the things where starting to work with countries to collect what they're doing and try to have more sharing to kind of come up with global or kind of blueprints, I think is key. And that's something we do in the International Learning Exchange, is really around sharing and developing that. Okay. Like we have made progress. This is great. Okay, so so can you hear me then, Miss Grace Milna? Can you hear me? Oh, sorry. It's Thomas. It's Thomas. Okay, sorry, Thomas. I believe you are representing Miss Grace Milna. Thomas, can you hear us?
Yes, I'm able to hear you. Are you able to hear me? Hello.
No.
Hello.
Oh my. Muli Bonji.
Tilibwi no kainu.
Yeah.
Okay, so maybe he can he go? Can you hear us now? We're muted somehow.
Yes, yeah. So maybe Mundo can start, then I come.
Okay, Maurice, then the floor is yours. Thank you, Maurice.
Okay, thank you very much. Can you hear me and see my screen?
You can maybe put it on full screen if you haven't already. Perfect.
Yes, good evening, everyone. Can you hear me?
We can hear you loud and clear.
Very well, very well. Ladies and gentlemen, good evening. Through the chair, can now proceed.
Yes, go ahead.
Basically, this is a Kenyan story, what we are calling a Kenyan strategy, and exploring the linkages, the opportunities, the strength, and probably also the gaps that we are currently experiencing in Kenya, more so when we are talking about WASH in schools, and to the title of the day, linking education, health, and gender, bringing all those stakeholders together in place. So I'm Maurice Otieno Mando, a WASH expert, currently working with the Ministry of Health. Currently with AMREF, and still conducting these issues of WASH in school. And indeed, I have to start that we cannot really overemphasize the impact of pandemic. And indeed, it was probably a blessing in disguise, because we saw an upsurge of issues of WASH in school being taken seriously. And that really worked to the advantage of issues of matters of WASH in school. And having noted that, welcome to Kenya, and Kenya indeed is a land of heritage and splendor, and I welcome you all one day to visit that. So basically, to dig into the crux of the matter, we note that currently, as the statistic states, we have 10 million children in Kenya enrolled in primary education schools, and probably these are what we call the basic education to some level. And this translates to the roughly 20% of the Kenyan population. And about this, we have 25% of the rural primary school going children. And these are figures according to the JMP. JMP has played a very critical role in that. And this actually means that millions of Kenyan children going to school are they go to school, and these schools probably don't have some of these sanitation facilities. And that means that the conditions are compromising, more so in terms of their health and educational attainment. And having noted that, Kenya also currently, just a snapshot of currently the gaps that we have in the country right now. And one that is coming out clearly is the incomplete data for school wash to support probably this subnational and the national planning. And then also there's a gap on also complex and clear institutional arrangement, and possibly issues of financing and capacity challenges. So that's a snapshot is probably the situation as currently in Kenya. And just also note something on the pandemic, and as I've alluded to earlier, this pandemic also highlighted the need of ensuring that we have access to clean water for the basic hygiene. And as it is standing out clearly that hand washing is the most single cost-effective way of preventing wash-related diseases, and the COVID-19 also is among those. And through that, having these hand washing facilities and the COVID being there, it was actually a wake-up call to the government and the relevant institutions that we need to take this matter of washing school seriously. And to that, just a case in point, in Kenya, we come up with the guidelines for health safety protocols. And this one was specifically for reopening of basic education institutions. And this one brought various stakeholders, including the Ministry of Health and also the Ministry of Education. And we had also the Ministry of Water and Sanitation. All these ministries came up with this guideline, and each one played a critical role in ensuring that we adhere to some, at least the fundamentals of washing schools. And this guideline was very key in ensuring that at least school meet the bare minimums as far as washing school is concerned. And just to continue to that, and this also shed light on some challenges, such as
Maurice?
Hello, can you hear me?
Yeah, we can hear you, but we do need to ask you to rather go, we're a little bit past time and we have the other presentation. So if you don't mind just going through this, we'll give you another couple minutes because of the time. Yeah.
Very
So
well,
we give you another,
well,
yeah, thank you.
Yeah, thank you very much, Belinda, for that. And as I've outlined, that ensured that these ministries came together on issues of COVID-19. And just to a snapshot of the policy planning and implementation, the Kenyan scenario, we have various stakeholders I've alluded to earlier, each one of them playing a critical role, like Ministry of Education, conducting quality assurance for the wash infrastructure, the Ministry of Health also ensuring that the COVID-19 also pertaining wash are adhered to, and also Ministry of Water and Sanitation are providing for working with the water service providers to ensure that we have also the infrastructure for washing schools. And we have also partners and civil society and community playing a role on that. And to that, the inclusivity in implementation entails various components. We have both public, private schools, and also schools in the challenging environment, in the arid and semi-arid, and also schools in the urban poor areas, such as slums. So basically, that is the inclusivity approach around the implementation to this. And a probably call to action is to ensure that we use the existing resources to provide the basic hand washing, and also covering through the matters of menstrual hygiene management, and also probably now just to integrate various stakeholders to ensure that our washing school is attained. And regarding that, the strategic mission, we want to ensure that all learners have access to appropriate water supply, sanitation, in hygiene in school, and that includes issues of menstrual hygiene management while at school, and also ensuring that all schools reach the national standard. And as alluded to earlier in the video that was playing, by adopting the 3-star approach. And there's a gap to that. Also, we need a protocol that needs to guide implementation to that. So basically, that's our strategic mission that boils down to strategic priority, ranging from the enabling environment down to budgeting, financing, and the sustainability to that. Forgetting not to mention the M&D aspect to it, where we identify the gaps and currently whatever is going on. And having noted that, currently the resources required, availability and opportunities, as our next to that, we are having a framework. Currently, there's a list coordination between the relevant ministries, as I've alluded to earlier, that is ensuring that this is workable.
Maurice,
And
Maurice, we'll
also,
just, sorry to interrupt. Maybe can you now, within the next 30 seconds, just kind of wrap it up? We see the costed plan, we see the call for action. Perhaps maybe you can just wrap it up and we will have you online. We will also attach your presentation to the Pathable so that others can see it fully. Yeah. So if you could just wrap it up in 30 seconds.
Yeah, sure. This is the last slide. Thank you very much, Belinda, for that. And also we have a costed plan there. And currently the government is in transition and rolling very strategic, the strategic plans. I'm also in the Ministry of Education where the current system for the Kenyan education is undergoing transition. And also we have our the 5-year account integrated development plans. And through that, we can exploit that also to actually now talk something to those plans and ensure that we implement WASH in schools as adequately. Also, we have also issues of NEMIS, and that's a data platform for reporting. And I think that also needs a bit of strengthening to that. And through that, I think that's the last bit of the presentation, and probably again to welcome you in Kenya to visit one day. Thank you so much.
Santi Sana, thank you. So Maurice has tried to, in a very short amount of time, and we thank you for that. Maybe we set up for Malawi quickly to basically explain the enabling environment, the framework in which the government is working. This is a national level, and how it was actually, a lot of it was spearheaded because of the pandemic, getting them on board. So that was very impressive. And thank you for showing a lot of work in a short amount of time to come to. Thank you.
Thank you very much. Thank you very much.
Yeah. So now we go on to the next presentation. I'm almost thinking we take the, yeah, maybe, oh yeah, he's, this is Maurice still. Is it possible we can take Dr. Maria Corazon? Yeah, maybe. Would you be ready? Maybe as we're trying to still set up from Malawi. Yeah, so we'll set you up. Thank you. So we are very, very, very pleased to have Dr. Corazon Dumlao. I've had the opportunity, I think almost for the last year or so, to see her in the little box of Zoom, but I'm so nice to see her in person. She is a medical doctor by profession and has been actively involved in the public health sector and education for over 27 years. She's currently heads the Philippine School Health Programs, Department of Education as the Chief Program Officer for the School Health Division under the Bureau of Learner Support Services. So pleased, all the way from Manila, she's here with us today. Thank you. That's right, you need this.
Good day, everyone. I'm Dr. Dumlao, the Chief of the Bureau of Learner Support Services School Health Division, and I'm happy to be here to share our best practices and our insights and snapshots of how the water, sanitation, and hygiene in schools, our WinS program, is able to link education, health, and gender in the Philippines. The BLSS School Health Division is proud of the continued milestones and successes of the DepEd Wash in Schools program in the Philippines. And through the Technical Working Group and its partners, UNICEF, Save the Children, and GIZ, it has been at the forefront of planning standards, developing a national strategy, and washing schools implementing mechanisms. Within this enabling environment, the promotion of hand hygiene is propped by a whole complement of wash services, a stepwise approach for improvement, graduated performance indicators, local level monitoring, and also it's coupled with the recognition and incentive system. The DepEd Washing Schools program, as well as our partners, is proud to share with you some snapshots of how the Philippine WinS impacts and affects education, gender, and health. We have DepEd Order number 10 series of 2016, or the Comprehensive Policy and Guidelines on Water, Sanitation, and Hygiene in Schools. The objectives have a broad scope of supporting water, hygiene, and sanitation practices, program implementation for education, practice, and sustainability. And this focus on key WASH indicators, which include water, sanitation, hygiene, deworming, and health education. I have copies of the booklets, which we will be sharing to the group so that you can see that we have materials that have been developed for ensuring that we have a standard understanding of the what, house, and the technical aspect of setting up the WinS. DepEd Order number 10 series of 2016 have a broad scope of objectives supporting the water, sanitation, and hygiene, as well as deworming and health education. And to cite, there are 8 components that are part of the program. This highlights massive information campaign, routines and practices, facilities, equipment, supplies, and stakeholder support to ensure that the standards for the 8 components are met. In targeting to provide this to all the students, we are ensuring that no learner is disadvantaged regardless of location, gender, or ability. And these components form a foundation of ensuring a safe and healthy learning environment to ensure that our learners increased capacity to learn and to maximize health-related or minimize health-related obstacles to school attendance and participation. Following an international and integrated concept of encouraging incremental improvements towards national standards, the Department or Ministry of Education continues to implement the 3-star approach, which has already been articulated by our official from the WHO. And it is used for programming, monitoring progress, ensuring quality, and recognizing exemplary performance. We are aware that yes, the first step is to come up with a policy, but you also have to come up with operational standards, and the 3-star approach enables us to enforce the standards. Each year, we see progress in the development of the data visualization through the dashboard, which has been developed in 2021. And here we presented improvement into seeing how individual schools fare in compliance to the indicators. We have 46,000 schools in the Philippines, and right now the OMS for 2022 covers already 96% of our schools in the Philippines. In 2021, we also released the WinS monitoring results for SY 2017 to 18, 18 to 19, and until 2022. And this presented promising results and showed not only a steady increase of participation rates of schools, but also a steady increase in all indicators for WinS. And this reflected the great efforts at the regional division and school level for the implementation of the WinS program. This support and effort continues even in the pandemic years, where we were able to ensure that the agenda for WinS are integrated in all the policies of the Department of Education as part of the efforts on COVID-19. The World Health Organization and the UNICEF Joint Monitoring Program for Water Supply, Sanitation, and Hygiene produces internationally comparable estimates of progress on drinking water, sanitation, and hygiene, and is responsible for global monitoring of the SDG targets related to WASH. And starting last year, data collected from the 3-star online monitoring system on WinS has been used as a reference in establishing the Philippine data for the JMP. This documented not just the status and progress, but the improvements in the implementation of WinS in the Philippines. What gets monitored gets done. Regular monitoring provides direction for schools, what to improve in the area of WASH, and the JMP report shows that there is significant progress towards reaching the SDG basic service levels on hygiene and sanitation from baseline to 2022. And we do recognize that there's still plenty of work ahead of us to sustain and improve these figures. Therefore, we are happy for our partnership with Unilever Philippines to mount a recognition program for outstanding and most improved divisions in terms of school sanitation. We envision that incentivizing improvements will help trigger action on all levels of governance, thereby strengthening the system and ensuring that each and every Filipino child is able to go to school without worrying about availability of basic WASH services. Now, what is important is we have the data, we have the evidence, and we applied science to ensure that when we present our budget in the Philippines, we are able to use the data as a basis for our policy formulation, redirection, as well as ensuring that we have a budget for the different components of the WinS. And at the subnational level, meaning the 17 regional and 223 divisions, these are also used for their planning so that the agenda for WinS gets integrated in their school improvement plan, in the regional and division improvement plan. Yes. So we were also able to participate in the Global Hand Washing Day and the World Toilet Day. And the pandemic also saw the WinS Technical Working Group support in the production of 3 videos in support of ensuring learning continuity and WinS advocacy. And we were able to utilize the DepEd TV. And part of the WinS series for DepEd TV is the infection prevention control. We utilize influencers such as our TV personality, Robbie Domingo, to highlight the healthy practices. And the third video on the series is the menstrual hygiene management video featuring none other than Miss Universe Pia Wirchbach. This video corrects misconceptions on menstruation and promotes the right information to better MH management. And we also have the Seal of Excellence Awards launched during the One Health Week in 2021. And then we also launched an online jingle dance campaign in support of IPC to intensify efforts for COVID infection and prevention. The WinS resources in various platforms, online and offline, we also have, and our efforts are aligned with the directions of the Secretary of Education. WinS is part of the Oplan Kalusugan, or operational plan for the Department of Education, which is the flagship program of the Secretary when it comes to WinS. And we also utilize enablers such as the massive open online course for the leading WinS for school heads and accelerating WinS for implementers, and also the infection prevention control, where more than 40,000 enrolled to the online courses. So what I'm trying to emphasize is that yes, we have the policy, but it's important to have a strong champion, which starts from the secretary up to the level of the schools. And then we have structures in place. We have the online monitoring system. We utilize different levels, different platforms, different levels of governance. And we continue to work with our partners to ensure that we'll be able to enforce the policy. Thank you.
Thank you. A very beautiful example of how you take the policy framework, have a very strong monitoring system, and incentivize those, and then to continue that to actually make a change. And I do think that the JMP report actually says that the Philippines is on track in many of the indicators to actually reach the SDGs. And so it's absolutely amazing, and really a credit to the whole collaboration and the champions in your work. Thank you. So I believe that it might be challenging to get Thomas is on. Okay, Thomas, you have got a very, unfortunately, we're finally glad to get you on, but we'll give you maybe, if we can do it in 3 minutes, 3 minutes. We have a couple online. The floor is yours. Are we still, is it sound? Thomas?
Yeah, thank you so much. Are you able to hear me?
We
Yes,
are,
yeah.
and you've got 2 minutes.
Thank you so much, Belinda. Welcome. This is Thomas Kanjodo from GIZ, Malawi Basic Education Program. Mine is a short one. Of course, much has already been said about GMP data for Malawi. It's not different from most of the sub-Saharan Africa. But of interest is want to hear what the Minister of Education is doing in ensuring that they are ensuring that there is safety in the schools.
Okay, we're not hearing the sound. You might have to put on the sound.
No.
Okay. Still not hearing the sound. Did you share the sound?
No.
Okay. We cannot hear. So you have to maybe stop the share and then just put on the sound. Thank you for joining. Yeah. Thank you for joining. Yeah. So we're just giving 1 more minute to share the sound. It's about a minute discussion. This is always the fun things on these hybrid meetings. We talk about inclusivity, and then it's really tough. Yeah, it really is. Because at some point you're like, oh my. Yeah, it is actually, and we're really pleased that we're able to get a rec. But any movement on it? No, Thomas. Okay, Thomas. Maybe we.
Yes.
Yeah, maybe we just will skip the video. We'll try to load it on the Pathable. Maybe just if you can summarize now in 30 seconds. You're losing the.
All right.
Key messages that she had to say, the minister from the Ministry of Education. Yeah.
Yeah. So basically, with the key messages is with the role the Minister of Education and the Minister of Health had in terms of development of the guidelines in relation to how the schools would prepare for the reopening, especially during the time that the COVID the numbers were increasing and the schools had closed. And one of the issues that the Minister of Education did was to do the assessment of the schools in terms of their readiness, looking at the water situations, the sanitation issues, and also the hygiene. So with the support from Global Partnership for Education, schools were provided with some resources to buy the buckets, which were used as the hand washing facilities, and they are also provided with the soap, and also the mother groups were trained to make locally available pads, which will be given to girls, especially adolescent girls, to ensure that they still remain in school. And the other issue, the ministry with the Ministry of Water and Ministry of Education, they had drilled boreholes in schools where the water situation was a challenge. And some of the examples that you are seeing, you will see that apart from the buckets which are bought from the shops, the schools, they also use the local available sources. Those are the bottles of water which are used as dip taps, which they use when learners use the pit latrines, then they wash their hands and they soap close by. And usually the ministry is also emphasizing the gender segregated in terms of the toilets. You have the girls' toilets and also have the boys' toilets, and the staff, they are also have their own different toilets. So the ministry is actually working with all the stakeholders to ensure that there is the schools remain open even during the pandemic. So since the reopening of the schools have never been closed again up until this time. Thank you so much.
Thank you, Thomas. Thank you. So for those, thank you for joining. So for those who want to hear more about the various examples, South Africa, Kenya, Malawi, in addition to the JMP 2022 on the WinS network website, there's actually a compilation. It's called WinS in Focus, and it actually looks at country examples, about 20 countries, what they did. And the idea again is to really see some of the strengthening of the coordination, implementation, even increased budgets in some cases for it. So if you want more details from some of the presentations that we couldn't show today, you can go on there. So with that, I think we sent ourselves now closing to the session. And I see Semran, you are there. So I'm going to introduce you. Maybe make sure that his mic is all working. Yeah. So Semran Gill is a senior sustainability social impact marketing professional with over 6 years of experience in the field of wash. He currently is the global brand manager of Domesticus Unilever and has been responsible for establishing the brand's credentials as a private sector leader in the space of sanitation with a keen focus and a very much appreciative focus on schools. The floor is yours, Semran. Welcome.
Thank you very much for that, for introduction, and also thank you for having me. It's in spite of the fact that I'm not there in person, but you've managed to orchestrate the virtual and on-site world quite well, I must say, compared to other sessions that I've been to. So well done. And it's an honor to be part of this such a distinguished group. So thank you again. I'm going to try and share my screen. So do let me know if you're able to see it. 1 second. Bear with me. How's that looking? I'm assuming you can hear, see me still, everyone? Okay, I'm going to take the silence as a yes for now. As we've been sort of speaking about, you know, this is such a deep topic. We can talk about data, we can talk about many different case studies and examples that have facilitated great change, but we are, of course, not under the assumption that we are close to finally improving wash in schools for all, once and for all. And we know that wash in schools is crucial to the development of future generations and society as a whole. This is not just the responsibility of public sector actors, as many of you are in the room today. NGOs, of course, partners such as UNICEF, as an example, governmental organizations, of course, with distinguished partners of ours, GIZ. It's all of our responsibility, including the private sector. And if we, as private sector, are not investing into the livelihoods of our children, then how can we expect that they will help our business in the future to grow? And at Unilever, we want to make sustainable living commonplace. That is the mantra, so to speak, our vision, our ethos that defines the business as a whole. And we want to and intend to work on a quid pro quo basis with our consumers, with the people essentially who buy our products, on that frame that if we do good by them, they will do good for us. And Washington Schools is paramount within that structure, within that framework of all the different issues that we have around the world these days. And you know, from a sanitation and from a sanitation perspective at Unilever, this is manifested, and I don't know how many of you are aware of the Domestos brand, but it's the leading toilet cleaning brand at Unilever. And before we get to the role of private sector in this space, I would like to briefly touch upon why we have the right to speak on this matter, and how is it that, you know, on that basis and where are we coming from, can we then influence the role of private sector and what can we bring to the table in order to facilitate change in this space. And it's fundamentally because of the fact we as a business hold ourselves accountable to our consumers, our customers, and our stakeholders to a specific sanitation related target. That is, as I mentioned, born out of the Domestos brand, which is to help 100 million people be able to access improved standards of sanitation and hygiene by 2030. And this target, essentially, it grounds us. It gives us purpose and clarity, whilst helping to guide the work we undertake with partners or independently through our own initiatives and programs. And with that in mind, and keeping that at the forefront of your mind, it's our expressed desire in this case to contribute to SDG 6 actively and materially. But nevertheless, if we have more large corporations committing to bringing about this change, we will actively see a real development in Washington schools. And that's the primary role of private sector. We have the means and the capabilities of being able to create scalable change. And nevertheless, this is only possible if you embody what is the work that what's the change that you want to be. You know, what do you want to see? What do you want to see? How do you want to impact society? And I think the differences in the work that we're doing in Unilever, but we hope that other private sector organizations take on the same approach, is that we hold ourselves directly accountable for that, for the outcome of these objectives. Because without having something as externally communicated as a target, for instance, then any sort of concerted effort to make a sustainable long-term change with our partners in mind will ultimately won't gain the sort of traction that we need. And we know that this is a multi-partner approach if we're going to be able to make a dent in this space and in this issue. So to bring me to the specifics then of how I believe we can support you on this journey as private sector, which for me is fundamentally to drive systemic change. And to do that, we must concentrate on what we have spoken about at length already, which is to create an enabling environment for Washington schools to improve and thrive. We saw some fantastic examples, of course, in Kenya. I've spoken about the amazing work that's been happening in the Philippines through the work we've substantiated with the Department of Education and GIZ. And this is just, these are best in class examples, but, we need more of these. And I believe it's through public-private partnerships such as the one that I've just described that we will be able to facilitate that kind of change. But nevertheless, what does driving systemic change mean? I'm sure for all of you who've been in Stockholm over the last few days have heard many, many different accounts of wanting to drive change. And I think it's important to try and substantiate that, to give ourselves at least some tangible actions or ideas that we can then fundamentally use that will hopefully take us on that journey. And to drive systemic change, invariably, we take it down to three key areas. The first is advocacy and political awareness. And what I mean by that is that we have, as private sector, we have the influence and we have the influence with political actors and citizen activists, in this case, as we often describe them as consumers, but nevertheless citizens of this world, through our marketing capabilities. We speak to over 2.5 billion consumers every single day, all of which would interact with some of our brands in one way, shape, or form. And it's through those means, whether it's through TVC, whether it's through the point of sale, whether it's then through our capabilities.
Simran?
Hello. Hi, Belinda, can you hear me?
Yeah. We can hear you. 30 seconds, please.
That's fine. I'm close to that. And whether it's through, as I mentioned, our abilities and our relationships with our partners in government, we're able to create that political awareness and have that top-down approach and effect with those key stakeholders in mind who can create that unlock, but whilst at the same time doing that important piece around grassroots activism and getting more people to care about WASH in schools first and foremost, and then subsequently wanting to support it and see a change in that space. And I think that's one of the things that we inherently suffer from in sanitation overall, is that, with the multitude of issues that we face in the world, it's not perhaps the sexiest top of mind issue that unfortunately people are speaking about on a daily basis. But, by working with private sector, by us making it more relevant in the way, in an appealing sort of way that can get people talking about it, I think we're able to then incite that political awareness and drive up that advocacy in that way. My last 2 points, I believe, are fairly self-explanatory, but innovative and scalable concepts is key, and trying to ensure that we look at the evidence gaps for future funding is essential for us to be able to help you create the change that you would like to see. And this again it couldn't be better sort of articulated by the work that we've done with UNICEF in India, where we have kind of combined our work together with the government of India there, and have facilitated wide-scale change that have helped over 28 million people gain improved access to a toilet since 2012. And we've been working as well alongside with 150,000 schools to improve operation and maintenance across the country. And it's because we've taken innovative approaches, we've tried different things, we've made sure that there was information at hand for us to be able to, for the guys at UNICEF fundamentally to come up with innovative concepts that can transfer from the world of private sector to the NGOs, and then something that the governments can essentially use in a meaningful, affordable and scalable manner. And then the last one, before I end it, and I believe this is crucial to anything, is capacity building and helping you to create tools for better on-ground solutions. We can theorize till the cows come home, but the role of private sector, and as we do with our business, is to deliver. We need to deliver every single day for our consumers and our citizens. We need to deliver every single day through our programs on the ground. And that is the way in which we hold ourselves accountable. We've delivered so far across many different geographies around the world. And I believe that this is an opportunity for us to be able to work more collaboratively together, use our innovation, use our scale, of course, our funding and our ability to be able to make things move at pace, to facilitate real change. And as I said, create that enabling environment that will drive systemic change. So these are my key 3 points of what I think we can do as a sector to help in that. Thank you very much for the extra few seconds as well, Belinda.
Well worth it. Thank you very much. Yeah. Yes, thank you so much. And I love the fact that you're saying we need to hold ourselves accountable. We need to put the targets and reach for those. And those 3 points on advocacy, innovation, and capacity are very, very key. So thank you very much. We have gone over time, but we do have a last, for those who have to go, completely understand. This is a busy time, but there is a last message from UNICEF to close us off. It's about a minute long, is it, or so? So feel free to leave if you have to leave. I want to thank you again for joining this session. Again, all the information you can find on the website. If you want to hear more country examples, and put your questions on Pathable. Thank you very much. And we go to this.